Chapter 13 Hormones Video Part 2. In this part of the video, we will look into 13.3 Effect of some hormones. After these sessions, you should be able to outline the role of the hormones insulin and glucagon in regulating the blood glucose concentrations. Insulin and glucagon are both hormones produced by the pancreas in the islet of Langerhans. Let's look at what is the effects of insulin. Insulin hormone decreases blood sugar concentrations. Usually this happens after a meal. How it decreases the blood glucose sugar concentrations? First, it increases the rate of the glucose uptake by cells. It also makes the cell membranes more permeable to glucose. Besides that, it stimulates the liver and the muscle cells to convert the glucose into the glycogen for storage. This happens in the liver when the excess glucose converts into the glycogen. Meanwhile, it also increases the oxidation of glucose during tissue respiration. Do you still remember the formula for tissue respiration? Oxidation of glucose here refers to the glucose with oxygens converted into the carbon dioxide, water and energy. What happens when the insulin is oversecretion? Oversecretion of the insulin result in abnormally low blood glucose concentrations. Some of the symptoms include hunger, rapid heartbeat, and irritability. In some of the severe cases, a person may lapse into a coma or even die. What happens when you actually lack of insulin secretion? When glucose cannot be stored or utilized by the tissue cells, some of these blood glucose concentrations will rise. The glucose is subsequently lost in the urine that gives rise to a disease we call diabetes mellitus. The lack of insulin secretions result in these abnormally high blood glucose concentrations. And when the tissue cells cannot utilize or store the glucose, symptoms include this weak body, continual weight loss, and glucose present in the urine we call the diabetes mellitus. Let's look at the effect of glucagons. One thing to take note, insulin and glucagons, they are both considered the antagonistic hormones. Means both of them react in opposite way. In this case, glucagon helps to increase the blood glucose concentrations. It stimulates the following conversions to increase the blood glucose concentrations by converting more of the glycogens into glucose, more fats and amino acids into glucose, and also the lactic acid into glucose. The main target organ of the glucagon is the liver. When there's low blood glucose concentrations, for example, when you are having diet or after exercise, this results in a low blood glucose concentrations that trigger the islet of Langerhans to secrete the glucagons. Hence, more of the glucose is produced by the conversions, for example, glycogen into glucose. And this results in the increase in the blood glucose concentrations. We have looked into the effect of both the hormones insulin and glucagons. Let's look at how is this look like in the cycle form. When the normal blood glucose concentrations increase after a meal, the pancreas will secrete the insulin that causes the liver to convert the glucose into glycogens. So this excess glucose converted into the glycogen causes the blood glucose concentrations to fall back into the normal blood glucose concentrations. However, what happens when your blood glucose concentration goes too low? The pancreas in this case will secrete the glucagon, which causes the liver to convert the glycogens into glucose. More glycogen converted into glucose causes the increase in the blood glucose concentrations, and hence the blood glucose concentrations goes back to normal. These two hormones are actually controlled by the negative feedback mechanisms that help to maintain the blood glucose concentrations at a normal level. We have looked into this disease, diabetes mellitus. Is a condition in which the body does not produce or properly use the insulin, which causes an insulin deficiency in the body, and hence the glucose cannot be converted into glycogens, causes the higher level of the blood sugar in the body. If this symptom is left unchecked, diabetes can cause to very serious problem. The high level of sugar actually causes poor circulations and nerve damage. It also can result in a small injury leading into tissue death and high risk of developing atherosclerosis. There are two types of the diabetes: insulin-dependent diabetes and insulin-independent diabetes. Insulin-dependent diabetes is usually hereditary and is due to the insufficiency of the insulin being produced. Some of the symptoms include frequent urinations, extreme thirst, fatigue, rapid weight loss, insulin shocks, and diabetes coma. For insulin independence, it appears in adults and is due to the cells not able to take in glucose. Some of the symptoms include blurred visions and fatigue. Aside from the 3 videos, we also attach a YouTube animations on what is diabetes mellitus. Please look at the video. And now we will look into a short animations to summarize the effect of both insulin and glucagons.
Insulin and glucagon, 2 hormones produced and released by the pancreas, are responsible for controlling the metabolic directions that fuel molecules take. Select an option. After a high carbohydrate lunch, like a plate of spaghetti, polysaccharides are digested into monosaccharides. Monosaccharides, such as glucose, are absorbed by the small intestine and released into the blood. Increased levels of blood glucose signal the pancreas to secrete insulin into the bloodstream. Insulin promotes the uptake of glucose by most cells of the body. Many cells, like muscle, burn glucose for their metabolic fuel. Fat cells in adipose tissue use glucose to make fat. Liver cells convert glucose to glycogen and fat. As the afternoon passes, the cells continue to take up glucose, and blood glucose levels decrease. By 6 o'clock, all the glucose from the spaghetti lunch has been absorbed, and blood glucose levels have fallen further. The low blood glucose puts a brake on insulin release from the pancreas. Without a glucose supply, cells switch to using glycogen and fat as their fuels. The liver breaks down glycogen to glucose and converts fat to fatty acids. Fat cells convert fat to fatty acids. These fatty acids are used by other body cells as fuel in place of glucose. The glucose released from the liver is reserved for nerve cells, which require a constant supply. Insulin and If a meal is skipped, blood glucose will fall below the normal post-absorptive level. This triggers release of glucagon from the pancreas. Glucagon induces the liver to break down glycogen to glucose. Liver cells release glucose into the blood, restoring post-absorptive levels. Without the signal from very low blood glucose levels, the pancreas stops secreting glucagon and the cycle is complete.
In the next part of the video, we will look into the comparing of the endocrine and the nervous control. Thank you.